Hi, my name is Dr. Meredith Warner, and I'm a fellowship-trained foot and ankle surgeon and orthopedic surgeon in Baton Rouge, Louisiana. So the technical aspects of the Cartiva procedure. The great toe is the first toe, or the big toe. The arthritic condition is usually in this joint, and it becomes very, very arthritic, very painful. The normal motion in this joint should be about 90 degrees up and like 40 to 50 down, but some people with this Hallux Limitus or Hallux Rigidus really can only move that much, if any, without severe pain, and that really messes up walking and running. So for the surgery, what we do is open up the joint, release all of the ligaments, get rid of any osteophytes and other problems, and then almost fully dislocate the toe. At that point, we can see this surface of the bone where the arthritis is mostly sitting. And what we do is we then use this device, which is a specialized proprietary reamer made with this system, and we actually attach it to a power drill, for lack of a better term, insert it into the great toe, and ream out an aperture to accept the cartilage replacement system, or the Cartiva, okay? And Cartiva is really just sort of a plastic, if you will. It's really nothing more than that. Almost the same material that we use in contact lenses. What we do then, and all this is sterile obviously, not like this situation, we insert it into this specially designed low tolerance device with an inserting stick, okay? And you very carefully impact it down to the end. And in surgery, what we do is actually on the back table where the surgical technician is we actually impact it all the way down to the very end. You can almost see it in there. And then with the assistant holding the foot, you actually put it up to the foot and impact it into the foot. And I'm going to leave it sticking out a little bit more than we do in surgery. We go about half more, so there's really only about 3 or 4 millimeters, but you can see it ends up being a very effective bumper and replaces the cartilage and takes away pain, but yet allows motion. And that's the beauty of it. And this was recently FDA approved here. It's been used in Europe and Canada for 15 to 20 years very, very effectively. It has an awesome track record. So I would highly recommend considering this procedure if you have the arthritic condition of the big toe known as Hallux Rigidus.